Good morning. Good morning to all. Good morning to our esteemed speakers and the hundreds of thought leaders, experts, and advocates, change agents who are listening in at the beginning of this very profound and important movement around sustainable international health equity. Let me welcome you from your locations around the world. Good morning, good afternoon, good evening, wherever we find you today. I have the wonderful privilege to serve as Chancellor of the University of Massachusetts Medical School, Massachusetts' first and only public medical school that has a foundational and fundamental social mission to improve the health and well-being of the individuals of Massachusetts and indeed around the globe. We are committed in spirit and in action to doing all that we can to elevate the human condition the world over. Now, while it's true that we have a special relationship to our Commonwealth of Massachusetts, we see our institution and the role we can and must play in a different light. Our medical school and our world-class and distinguishing assets, namely our innovative programs, our novel platforms, and our stellar people, are global resources that can and should be leveraged to bring hope and to offer healing to people anywhere and everywhere. This ethos explains why we've been working side by side with the Republic of Liberia since the end of this Liberian civil war to rebuild that country's healthcare infrastructure, including medical education and training programs, and why we remained in Liberia even as the Ebola outbreak engulfed and overwhelmed the country's fledgling healthcare apparatus. It also puts in context why we proudly operate the nation's only university-based, nonprofit FDA-licensed vaccine and therapeutic development and manufacturing organization that focuses on unmet public health needs, including developing a monoclonal antibody for rabies in partnership with the Serum Institute of India. As we know all too well, living through the Ebola crisis and many other public health emergencies from SARS-1 to Zika to MERS and most recently to SARS-CoV-2. Pathogens, viruses, and diseases care not about national boundaries, geographic barriers, or cultural differences. And in fact, they enhance and take advantage of health inequity. It follows then that those institutions and organizations involved in the provision of care, the practice of medicine, the promise of biomedical research, the production of life-saving vaccines, and the passage of healthcare policy must transcend parochial interests and myopic concerns in order to think, act, and make a difference on a global scale. As our august group of speakers have long known, healthcare, healthcare policy, and health equity are interrelated, interdependent, and international. And as such, they require international approaches and global solutions. Among many things the current pandemic has laid bare is the devastating consequences emanating from the myriad vulnerabilities, inequities, limitations, and gaps inherent in today's healthcare delivery systems and public health infrastructure. Now more than ever, we need leadership, we need coordination, we need experts, we need action, we need the World Health Organization, and we need all of you. Today, I hope and trust that we're coming together to bear witness to the stirrings of a new movement focused on one of the most pressing societal issues facing the globe: how to work toward, achieve, and sustain health equity on a global scale. Now, while this has been a grassroots effort years in the making, those calling for ethical global leadership to confront inequities in healthcare garnered the attention and engagement of some of the most well-known and influential organizations, beginning with the United Nations and the World Health Organization. The participation in today's webinar of such renowned leaders as WHO Director General, Dr. Tedros Adhanom Ghebreyesus, and the UN's High Commissioner on Human Rights and former President of Chile, Dr. Michelle Bachelet, among many other luminaries from all corners of the globe, speaks volumes and emphasizes the importance and impact of this nascent movement. Now, given the time constraints, I cannot introduce each and every speaker, but you will be hearing from this outstanding and diverse group very shortly. I do, however, want to thank today's guest speakers for their time, their presence, their leadership, and their example. I especially want to thank and introduce our next two speakers, who are longtime collaborators and committed health equity advocates, and who have helped to spearhead this movement and today's gathering. First, I want to welcome today's moderator, Dr. Juan Garay, Professor of Global Health at the National School of Public Health in Spain. Following him will be our own Dr. David Chiriboga, an Associate Professor of Medicine at our University of Massachusetts Medical School, who is a former Minister of Health of Ecuador and former President Pro Tem of the Council of Health Ministers of South America. I thank them for their leadership. I thank you for your leadership. And now let me introduce Dr. Juan Garay.
Thank you, Councillor, and thanks from all of us for hosting this meeting. Good morning from Havana, Cuba, to you all, friends we know and friends we don't know yet. This meeting is being followed by over 1,000 participants from over 100 countries. It is the launch of the Global Movement for Sustainable Health Equity. Let me start by saying we want to remember those who lost their lives for this pandemic and pay a sincere tribute to their families for the loss of their loved ones, also to the immensity of children, women, and men that are in the world invisible to the states. And finally, to the brave health teams worldwide that daily risk their lives to care for those infected. This is about equity. When a shared objective as universal human rights is feasible for all, equity becomes an ethical principle. Why is that? Because it is only through the fair distribution of resources that the shared objective may reach all. And why health equity? Health, that is physical and psychological well-being, is the main shared global objective across all countries and times, and the cornerstone of all human rights. Health equity is the commitment of all countries as members of the World Health Organization since 1948, which states the best feasible levels of health by all peoples. And why now? While health inequity has bled millions of human lives through many decades, the COVID pandemic has revealed how socioeconomic inequities are the main root causes of ill health, which in turn further undermine social justice. There is another dimension of equity which is essential to our movement. It is our damage to nature that breeds pandemic as this one, and which, through climate change and other man-made imbalances of natural cycles, threatens to undermine the health of our children and the very survival of coming generations. Hence our cry for sustainable health equity. We are concerned and committed and stand ready to work to contribute to a transformational change. And why change? Because if we produce and consume without knowing our carbon footprint and collectively are drowning the planet of our children in smoke, we need to change. If less and less can make ends meet, while fewer accumulate most wealth, we need to change. If the persons whose jobs are revealed now as essential cannot be protected in their homes, and are those with lower salaries and rights, including healthcare, we need to change. If most basic sciences are publicly financed, while their discoveries are taken by a few corporations, translated in billions of profits, blocking access to life-saving drugs to those in greatest need, we need to change. If some rich countries are holding resources and life-saving vaccines, diagnostics, and medicines on stock, or even before their production, and leave the rest at their mercy, we need to change. If while most people are badly hit by the crisis, unemployment rises, and extreme poverty increases, if while that happens, Wall Street and financial speculation make some few massively increase their fortunes, we need to change. Because besides the ethical principle of equity I mentioned, rich or poor, no one, rich or poor, white or black, man or woman, will be safe from the pandemic on his own. We can only overcome it together in solidarity and in equity. We must all contribute to a fair world where sustainable health equity is the cornerstone of all societies. And now, let me introduce to you my colleague and friend, David Chilboga. He is a physician from Ecuador committed to social justice. He is former Minister of Health of Ecuador and former President pro tempore of the Council of Health Ministers at the Council of Nations. And he is currently Associate Professor of Medicine at UMass Medical School. The floor is yours, David.
You're muted, David.
Thank you. Thank you very much. I was saying thank you very much, Juan, for your introduction. And thank you, Chancellor Collins, for your wonderful welcome remarks. And I'm very proud to be part of this institution. I want to thank all of the people who have joined today. As Juan was saying, we have over 1,000 people from over 100 countries, and we are here because of you. I worked for many years with indigenous populations in Ecuador, in the highlands of the Andes, in Zumbawa, and there I learned a lot about what equity means and why we're here. And I think that the whole purpose of this movement is to advocate for those people who often do not have a voice and who represent the majority of the world. I want to thank also all of the institutions who have supported this effort. Barely 10 weeks ago, we started with this process, writing a letter with a group of colleagues and sending it to the United Nations Secretary General. We have received a tremendous amount of support from very strong institutions and professionals in healthcare and in science and advocates for health from all over the world. And we want to thank you also for the receptiveness by WHO and the United Nations. And we're looking forward to continue the collaboration, because the challenge that is facing us requires that we all come together and give a hand. Could you change the slide, please? Why did we write this letter? Well, as we were watching these devastating pictures of bodies lying bare in the streets of Guayaquil in my home country, Ecuador, and seeing how the reports were trickling in of the disproportionate impact of the pandemic on people of color in New York, in New Orleans, in Chicago. And we were very concerned about as this was playing out and as the pandemic progresses, how is it going to affect the majority of the people in the world, that 80% of the population who live under vulnerable conditions, particularly in low and middle income countries, but also within high income countries. There are many vulnerable. Vulnerable people are at increased risk of exposure. Once they get exposed, there are a greater risk of infection because of many of the comorbid conditions, and also are at increased risk of death because of all of the factors related to exposure, but also because they tend to have less access to healthcare. And the presence of a for-profit system is really a fundamental challenge, which it's a perspective of thinking of health as a commodity and not as a human right. We have definitely have to acknowledge that worldwide the health systems have not been prepared to confront the magnitude a pandemic of this magnitude. Seeing how the healthcare systems in the United States and in Europe, with all of the resources, have been brought to their knees with the pandemic, we can only imagine what is happening in the rest of the world with much fewer resources, and their lives are concerned. One of our major concerns in this process was the hoarding, the speculation, and profiteering from the crisis. We need to condemn these practices in the strongest terms. I was shocked to wake up yesterday to read the news of the U.S. government purchasing all the stockpile of remdesivir. This is unconscionable. We need, as all of the as the Chancellor and Dr. Garay said, we need to think about the entire world and not just about ourselves. And finally, the epidemic has brought about unprecedented unemployment, and the economic impact in all of these communities. All of these factors put together make that there's an amplified impact on all of the structural inequities and the racism, both during the pandemic and after the pandemic. Next slide, please. Just a quick graph here on the left that shows that a study from Harvard University, that if you are poor, if you live under crowded conditions, and if you're a person of color, you're much likely to die from COVID-19 than otherwise. And on the right, the graph, a study by Oxfam International that says that if there is a decrease in 20% of the income worldwide, it will have an impact of pushing about 500 million people into poverty. Next slide, please. That's why we're calling for an equity-focused, comprehensive, coordinated, and compassionate global response. What do we mean by this? We see that wealthy countries are developing their own emergency economic rescue packages, but we need to think about the entire world. How are we going to come with a proposal to support the economic needs of the entire world? And that's when the United Nations system and the international financial institutions come about. Science and knowledge need to be considered and treated as a common public good. And we need to strengthen the international legal framework to abolish the patents for all the pandemic-related products. We do have a framework, and we need to implement it. Profits cannot come before life. And then it's very important that we need to have some structure to safeguard an equitable and viable global supply chain. How can we make sure that all of the countries in the world, all of the low-income countries around the world, can have access to all the supplies that we need in order to protect our healthcare workers, and also our patients and our entire population and the essential workers. Next slide, please. Why have we we reached out to the United Nations and we asked that WHO lead in this effort? Well, because they have a constitutional mandate to lead. We think that health is the best barometer of inequities. If you see the health of a population, it represents the living conditions of that population. The WHO needs to coordinate with all of the pertinent United Nations global and regional bodies, the Council of Human Rights, the Social and Economic Council, the United Nations Development Program, UNICEF, the International Labour Organization, and as I said before, the international financial institutions. Use the lens of equity in order to to guide the response to the pandemic. Next slide, please. So I just want to leave you with 3 key points. Number 1, the COVID pandemic amplifies the structural inequities. It's not the great equalizer as has been touted. Second, we need a global, coordinated, unified, comprehensive, and compassionate response to the pandemic, which is focused on equity. And finally, we need to defend, strengthen, and empower the UN system, because it is our only supranational democratic body. There's no other body in the world that does that. With the words of Nelson Mandela, it always seems impossible until it's done. Let's get to it. Thank you.
Thank you very much, David, for your words. I believe we have Dr. Tedros Adhanom with us. Is that so, Dr. Yamamoto? I saw him a minute ago on screen. We cannot hear you.
Okay. He's coming.
Okay. So it is an honor to have you, Dr. Adhanom, the World Organization, first ever African in this position, former Minister of Health.
Talk to you.
There was no need.
And as we have just said, and David has reminded, as we stand for equity, we also stand to support the role of the World Health Organization, the mandate in these hard times for all humanity. Yours is the floor, Dr. Tedros.
Thank you. Thank you, dear colleagues and friends. Thank you for the opportunity to say a few words today. As you know, the COVID-19 pandemic is the defining health crisis of our time. As I speak, more than 10.3 million cases have been reported to WHO, and more than 508,000 people have lost their lives. Of course, the impacts of the pandemic go well beyond the suffering caused by the virus itself. All over the world, lives and livelihoods have been thrown into turmoil. In many countries, essential health services have been partially or completely disrupted, including antenatal care, cancer diagnosis and treatment, and services for mental health disorders. Millions of children are at risk of missing out on routine immunization. The fight against polio has been set back. At the same time, we know that this is much more than a health crisis. Millions of jobs have been lost, and according to the International Monetary Fund, the global economy is headed for its sharpest contraction since the Great Depression. The knock-on effects of the pandemic in terms of health and inequality will be profound and felt for decades to come. As usual, those who can least afford it have paid the highest price. The pandemic has highlighted and exacerbated the glaring inequalities of our modern world. The rich can afford to stay home and stay safe, while the poor must go out to work to feed their families. The rich have access to life-saving health care, while the poor do not. Unfortunately, this is not a new story. Every day, millions of people are exposed to sickness or poverty simply because of the conditions in which they live and work, or because the health services they need are not available, or they can't afford to use them. WHO was formed more than 70 years ago on the conviction that health is a human right for all people, not a privilege for those who can afford it. That conviction remains at the heart of everything we do. It's why we have made universal health coverage our top priority. We're working for a world in which all people can access the health services they need without facing financial hardship. But we're also working to address the reasons people get sick and die in the food they eat, the water they drink, the air they breathe, the conditions in which they live and work, and the inequities they face. But even before the pandemic, the world was a long way from realizing that vision. On current trends, up to 5 billion people will lack access to some essential health services in 2030. As the pandemic has illustrated, the lack of access to affordable, quality health care doesn't just put lives at risk. It's also a brake on social and economic development and a threat to global health security. My dear colleagues and friends, the COVID-19 pandemic is a public health challenge, an economic challenge, a scientific challenge, and a political challenge. But it's also a test of character for all of us. It's a test of whether we can truly come together in a spirit of solidarity to protect those who are most at risk. It's a test for governments at the international level, but it's also a test for each of us as individuals in our own communities. Even if we ourselves are not in a high-risk category, the choices we make every day could be the difference between life and death for someone else. We have a shared responsibility to keep each other safe, both locally and globally. That means we have a shared responsibility to ensure that as vaccines and therapeutics become available for COVID-19, they're available for all. It also means we have a shared responsibility to address structural discrimination and racism, poverty and inequality. In April, together with the European Commission and multiple other partners, we launched the Access to COVID-19 Tools Accelerator to catalyze the development and equitable allocation of vaccines, diagnostics, and therapeutics. WHO welcomes and supports the Sustainable Health Equity movement. We're committed to working with you and with our colleagues across the United Nations to scale up the health response, to safeguard the lives and livelihoods of the vulnerable, and to build back better. I thank you.
Thank you very much, Dr. Tedros. Your words are very inspiring. You must be the busiest man on the planet now, so we understand you have to go. But please, count on us. This is a very high-based grassroots movement, probably gathering over 20 million Professionals and advocates, we are your allies in the right to health. We are the allies in fighting for equity. So don't forget us. We are by your side. We will support your mandate, and we will support the need of WHO to have the means to lead the way. Thank you very much for your time.
Thank you so much for having me. It's a great honor joining you. Thank you.
Okay, so thank you. We will now have, if you want to wait, probably you're very busy, but probably you want to enjoy Dr. Tedros, because we now have Dr. Michelle Bachelet, who has sent for us a recorded 5-minute video, but I think it is very important on the right to equity and the right to health. As we all know, she's a physician, former Minister of Health and of Defense, and former President of Chile during 2 terms. She was also the former President of UN Women, and currently she is the UN High Commissioner of Human Rights. We will now have a video recorded for this event.
Excellencies, ladies and gentlemen, colleagues, let me thank you for giving me the opportunity and honor of taking part on the launch of this movement, which in a matter of months has managed to gather over 200 organizations and networks from all regions. Together with advocates in their personal capacity, this movement represents health professionals, scientists, social movements, and advocacy groups around the world. It is in times of crisis when humankind can show its greatest potential of collaboration and generosity towards noble goals, and this movement is a clear proof of that. I would like to share with you some thoughts of the challenges we face and the opportunities we have to work together. Throughout my life and in my capacities as a medical doctor, minister, head of state, director of UN Women, and now UN High Commissioner for Human Rights, I have witnessed how human suffering is rooted in injustice and discrimination. I value your focus on equity as an ethical principle that is a feasible and shared goal across times and cultures, that makes health equity a good barometer of social justice within and between countries. Humanity has advanced in technology and life expectancy as never before. Yet the fruits of such progress are spread unevenly and exclude much of the world. Excess accumulation by the few has the price of loss of life, hopes, and dreams of a large majority. Your concern and commitment on, and I will quote, sustainable health equity, end of quote, captures in those 3 words the essence of what we need to fight for together. This is even a greater priority as the COVID-19 pandemic has revealed the link to inequity, cause, and consequence. Our global production and consumption machinery has resulted in climate change and in an unlivable world for our children. It is also the fertile ground for the current and possibly more pandemics to come. And the consequence of the pandemic hits hardest the marginalized and those subject to discrimination, hampering their access to food, water, housing, jobs, healthcare, and education opportunities, all of them unequivocal human rights. So we need to act urgently and with courage. We cannot leave justice, that is sustainable equity, to occasional goodwill, philanthropy, or ad hoc initiatives led by those with the economic or political power. Justice and sustainable equity need to be guaranteed by a legal framework with a clear identification of the content of the right, of the duty bearer, and the rights holders. Declarations are important and need to be grounded to covenants with state obligations and accountability frameworks. As you are aware, almost in parallel to the Universal Declaration of Human Rights, the World Health Organization based its constitution on the best feasible level of health for all peoples. That is health equity. But those goodwill statements need, as I said, legal frameworks. The International Covenant on Economic, Social, and Cultural Rights came some 20 years later and translated WHO constitutional objective in a right. 20 years after, the Declaration of Alma-Ata highlighted the link between all human rights and public health. When world leaders adopted the 2030 Agenda for Sustainable Development, we celebrated this momentous milestone. We will all work towards the transformational vision of a world with equitable and universal access to healthcare and social protection, where physical, mental, and social well-being are assured. But a third of the way through the SDG era, almost 2 billion people worldwide have no access to essential medicine. We cannot be complacent with a world that largely leaves the progress of vital vaccines, diagnostics, and medicines, as well as the access to health care, up to market dynamics, which barely measures the burden of inequity, continues to increase health gaps between and within countries, and undermines the health of the coming generations. It is time for a profound change, and that takes courage and collaboration. We need to make a quantum leap linking the right to health to a life with dignity and to national and international socio-economic equity. I encourage the Sustainable Global Health Equity movement to raise the moral imperative of sustainable health equity, now even more clearly revealed by the COVID-19 pandemic, to a strong international legal framework and contribute to its political support, social awareness, follow-up, and recommendations at the global and national levels. Thank you.
Well, as you have heard, Dr. Michelle Bachelet addressed our meeting as well, highlighting the very important link between the right to health and the right to a life in dignity in societies with sustainable health equity. So thank you to her and her team for their participation. Mr. Antonio Guterres, Secretary General of the United Nations, is busy at a UN Security Council meeting. He has sent a message excusing himself, restating his acknowledge of our movement and his willingness to see how we can collaborate as well with his office. And a member of his team is among our participants to with the information and to continue exploring our collaboration. May I now introduce Dr. Paolo Bus. Paolo Bus is a friend, a colleague, and may I say to all of you, he is the soul behind this meeting and much of this movement. Those of us who know him are always carried away by his enthusiasm. He's a Brazilian medical doctor, PhD in global health, emeritus professor of the Osvaldo Cruz Foundation, and full member of the Brazilian National Academy of Medicine. Yours is the floor, Paolo.
Good morning, good afternoon, good evening, everyone. Thanks for coming. The Sustainable Health Equity Movement is an eclectic and deeply engaged group in the promotion of health equity that gather more than 200 global, regional, and national entities representing around 20 million professionals from around the world. It includes prominent scientists from several fields of knowledge, public health professionals, general and intensive care doctors, critical or intensive care nurses, primary health care professionals, students, youth people, as well as grassroots people and movements who are at the front of the fight against coronavirus and pandemic. Many prominent former heads of state, former ministers and politicians of different backgrounds support the movement since its beginning. Today, the world faces a life-threatening pandemic that has taken away many and has paralyzed the economy, driving millions out of work and into destitution. It has amplified in a disquieting scale pre-existing social, economic, environmental and health inequalities and inequities everywhere. The state of the world is bad and getting worse to the point that the conditions for our own survival may not be sustainable if you do not correct our course, improve a profound structural, social, economic, environmental, and health changes beyond the current pandemic. Indigenous people, Afro-descendants, and other minorities are especially vulnerable to the pandemic and beyond. Therefore, if you are claiming since the pandemic began for the ethics of social and health equity, it will be necessary to maintain this action for the post-pandemic future. Since we know that when the epidemic is overcome, these inequalities and inequities will certainly go even deeper. The group has been working together and we will continue to work so we could have a concrete possibility to reach an increasingly more egalitarian, fair, inclusive, and compassionate world. We intended to join our efforts to carry out advocacy and concrete actions at all possible levels of action, global, regional, sub-regional, national, and local, to globalize the defense of social and health equity and the fight against inequalities and inequities. In this sense, we need multilateralism more than ever. We need a strong United Nations and its agencies. We need a strong World Health Organization. The movement should also work closely with other networks and organizations that share our vision, supporting one another's efforts. For example, with the Framework Convention on Global Health Alliance, which has been advocating for a global treaty based in the right to health and aimed at national and global health equity. For the global launch of the movement at this event, we intended that the technical, political, and epistemic communities gathered here will project their joint action at regional levels, from the Americas to Africa, Europe, Asia, and Oceania, as well as at the national level of each of our countries. Let me give you an example of the national projection of the global movement using the case of my country, Brazil, with its immense social and health inequalities and inequities, obviously materialized in the epidemic by 19 COVID. Here, we plan to organize a science, health, and social movements coalition to monitor the inequalities and the inequities together and to act at the executive, legislative, and the judicial branches of governance to reverse the situation and ensure a fairer, because more equitable society. We have faith, convinced, and hope that the flame that started to burn for social and health equity since the first day we met virtually will keep us together and project actions to the real world where the inequalities that must be the object of our collective action really take place. This certainly implies building a new social pact, reestablishing the state, and placing the economy at the service of people and not of itself. Thank you very much for your attention.
Thank you so much, Paolo. I think you have captured very well the magnitude of the challenge, the need to network, the need to defend multilateralism, and the vision and the potential of our movement. We will now have presentations of the leaders of the global networks within our movement. We have many other organizations, over 200. These ones represent those who have a global reach. So first of all, let me introduce to you Professor Lydia Bristol. She holds a South African research chair on health workforce and is professor of public health at the University of the Witwatersrand in Johannesburg, South Africa. She is the immediate past president of the World Federation of Public Health Associations. She was the first woman from Africa to achieve that honor. So yours is the floor, Leticia.
Thank you very much, Dr. Garay. The World Federation of Public Health Associations, with its headquarters in Geneva, is 53 years old. The World Federation represents more than 100 public health associations, which collectively have a membership in excess of 5 million public health workers. Since our inception in 1967, the Federation has emphasized social justice, equity, and human rights as its core values. Hence, the Federation is proud to be a founding member of the global sustainable health equity movement. Our key messages at this important event are four. Firstly, as many of the speakers before me have highlighted already, the COVID-19 pandemic has laid bare the existing inequities among and within regions and countries. Now more than ever, the world needs strong global ethical and accountable leadership that has equity as its guiding principle. We support the United Nations and the World Health Organization unequivocally in their global mandate to exercise equity-oriented leadership and to steer the pandemic response. Our second message is that we advocate for collective and individual action to address the social, economic, and political factors that drive health inequities, because these factors are shaped by policies which make them amenable to change or interventions. Our third message is that we must never forget that health equity includes racial and gender equity and social justice. Governments, corporates, and civil society should develop structures and processes that support health equity and that confront structural and systemic racism and sexism, as well as other social determinants of health. And our last message is that we call on and support the efforts of public health associations and professionals to generate and or present evidence to ensure that health equity is a key priority of all of those in leadership positions, whether that leadership is at a global level, whether it's at a national level, and or at a local level. I thank you.
Thank you so much, Leticia. I have been told that my mic has some echo, but that is my function today, to echo some of your messages. And as you well said, COVID-19 is revealing global inequity. It requires collective and individual action. Okay, racial and gender inequity and social justice, and the value of the public health associations is essential to face the challenge. So thank you very much, Leticia. We have now Professor Volker ten Meulen. He's president of the Inter-Academy Partnership, a global network of academies. He is a biologist by training. He is past president of the German National Academy of Sciences, Leopoldina, and of the European Academy Science Advisory Council. Volker, yours is the floor.
Dear colleagues, ladies and gentlemen, I would like to thank you on behalf of IAP that we are participating in this very important activity and that we are here today to give you some sort of inside look into IAP. I assume that many of the webinar participants are not familiar with the IAP group and IAP activity, and I will give you in the next slide just a short overview so that you get some sort of idea. May I have the next PowerPoint, please? Okay, you see here a global distribution, and you see that we do have about 140 member academies coming from science, medicine, and engineering, and they are distributed globally. These academies, which are globally distributed, have formed so-called affiliated regional networks. You see these networks here with abbreviation as ESAC, ASA, NASAC, AENAS. They are in the Americas, they are in Africa, they are in Asia, and they are in Europe. And these networks are very important for IAP because they ensure a greater regional relevance of IAP work, and which is carried out in many aspects by these regional networks. What are the objectives of IAP? To provide regional and global science advice to policymakers, to initiate and support programs on capacity building, science education, and science communication, to take a leading role in efforts to improve the effectiveness of international science cooperation. Now, some of you may ask, how can one work in such a group globally together or regionally together? I will give an example. May I have the next PowerPoint, please, the next slide? You will see here an example of where IAP just finished a study on food and nutrition security and agriculture. And the question was, what can science contribute to these burning questions, in which way can science take up issues, work on the scientific ethic, and help that food and nutrition security can be achieved. And what we did is that we defined 10 major questions which are relevant to science and to food and nutrition. And these 10 major questions were studied independently in these 4 regional networks, ESA, IANAS, ASA, and sorry, and IAP. And these networks produced reports on these questions, discussed the results in the region, among societies, among politics. And in addition, out of these 4 reports, a 5th report were produced in which the similarities and dissimilarities of these reports were compared, and the global recommendation was made. And this was highly respected by different organizations like the European Parliament, the European Commission, by the African Union, but also by WHO and other UN organizations. And at the present time, we are working on the topic in a similar way on climate change and rights, and also including there certain aspects of COVID-19. May I have the next slide, please? Now, what can we bring as IAP to this new initiative of health epidemiology? Of course, information exchange. We cannot bring it from the national to the regional and global level. We have the means, we have the experts, and we can then select the experts which are actually then take up certain issues and give certain advice. We have the ability to convene and bring the groups together, to link with governments and with stakeholder parties. And I think we have given an example of science advice to policymakers, which I just mentioned. And of course, we have ongoing programs on science education and science literacy, which are so important for all of us, and for the young generation, so that they are familiar with what science is all about, so that science can play its role. May I have the next slide? So the question, of course, is what did we do with COVID-19 pandemic? I think COVID-19 pandemic has shown how important science, biology, was at the forefront, was able to identify and develop test systems, studied the way in which virus was spreading, etc., and giving advice which is so needed in every country. So this is something, of course, which is a strength. And it is what we did is calling for global collaboration to tackle the pandemic, because in March, when we prepared this call, it was obvious that all the states were only concerned about their own problems, which is of course understandable. But at the same time, I think we had forgotten at that time this is a global threat, and the global activity is certainly needed. We highlighted the advisory and public outreach efforts of academies, the connecting academies to aid learning from one another national situation, lesson learned. So we have an exchange between the networks, within the networks, and so we have also set up a big group of experts globally to give advice, to help when help is needed from a science point of view. May I have the next slide, please? Of course, it is important that we ensure equity in our work. I think it is very much a demand in our time from different aspects. So of course, whatever we do is open The nomination of experts and committee and working groups are invited from all our members. IAP status and rules of procedure, of course, ensure that we do have regional representation, that the Africas, the Asia, the Pacific, Europe, the Americas, they're all involved if questions come up which we should address. And what I think most important also is that we count and include young scientists. You know, there are a growing number of young academies created, and there's also a global young academy, which from the very beginning IAP has supported, in which we can always draw young scientists which help us to solve important questions. May I have the next slide, please? This is actually what I wanted to tell you. We are very happy to participate, and you can count on us that we will give our most effort to this new project to help from a science point of view where it is possible. Thank you very much.
Thank you very much, Volker. I think the IAP reveals what is the importance of networking very, very strongly. It is networking that makes our brain work. Even if we have 10 times the number of neurons, it is basically the networking between all of them that makes us function, think, and act. And you have very well described how your network, your wide global network, stimulates the development of knowledge, issues recommendations to national and international policymakers, and also spreads those that advance of knowledge through communication strategies. You've highlighted two examples on food security and nutrition, and climate change and health. So very important factors of health and health equity. And in them and in all of your work, you are addressing equity as a main principle. So we are really honored to have the IAP network within our movement. And thank you so much for your words. We will now have Dr. Miryadi Flora. She is Vice President of IAMPHI, which is the International Association of National Public Health. And she is the Director of the Institute of Epidemiology, Disease Control and Research of Bangladesh. Yours is the floor, Miryadi.
Thank you. Thank you very much for inviting IAMPHI in this important global launch event. Distinguished participants, we all are going through a very critical time. COVID-19 pandemic raised a very important question about global preparedness of health system. There are disparities in responses within and among the countries, among the region, and among the continents. One thing is common in all countries, that national public health institutes are playing the key role. And IAMPHI appreciates and recognizes its role in this regard. As you know, IAMPHI is an international non-profit association of national public health institutes. It seeks to strengthen the public health functions in national public health institutes worldwide to protect and improve population health at the country level. IAMPHI comprises 114 member institutes in 99 countries. In addition to this global network, we have additional 4 regional networks also in Africa, Asia, Europe, and also Latin America and Caribbean. The mission of IAMPHI is to bolster global public health capacity by creating, connecting, strengthening the world's national public health institutes. The vision is a robust and integrated global network of public health institutes, taking action to address the public health challenges at the country level. IAMPHI intends to support the national public health institutes by fostering sustainable, transformative changes that enhance strategic and technical capacity to respond more effectively and efficiently to public health challenges. IAMPHI's unique role as a professional network is information exchange and peer-to-peer support. Moving forward, there is potential to strengthen this function, for example, by providing a platform for collaboration, sharing materials, expertise, and experiences. ENFI has a key role in developing institutional capacity across the network of public health agencies worldwide. ENFI can provide guidance to support national public health institutes' advice to national governments through science-based evidences. ENFI's peer-to-peer support aims to strengthen autonomous and sovereign countries' expertise in order to build national public health capacity. It advocates national public health capacity building since its very beginning for global health equity, considering diversity of these institutes and countries. The unprecedented situation of COVID-19 pandemic highlighted the need for global sustainable health equity, and it also can be said from this initiative that never before, social and economic inequalities and health inequity have been so much acknowledged by the health-related civil society. ENFI strongly believe and support continuous advocacy for national governments and international agencies to become aware of major social determinants of health and also pursues goals and policies tending to reduce inequalities all over the world, but more intensively hitting regions. I'm very optimistic that this new initiative will greatly support the international effort, and I'm really glad to say that ENFI is and will be part of it. I believe our peer-to-peer support approach would facilitate to ensure equity in the country's response capacity. Better prepared national public health institutes would share their experience and expertise with less developed national public health institutes. On behalf of ENFI, I would like to express our commitment towards equitable global health. Thank you very much again for inviting us. Thank you.
Thank you very much, Nuriadi. I believe when we heard earlier on Dr. Bachelet speaking of the right to health, we may remember how the right to health in the International Covenant of Economic, Social and Cultural Rights is very well described, that it must be guaranteed by the government. It's a government duty to promote and protect the right to health. And ENFI stands for that. It stands for the public health function of the government on promoting and protecting population health. And the way you describe how you work and how you strengthen your role in advising governments with evidence-based public health strategies makes your network crucial to the transformational change that previous speakers have been mentioning. And your commitment to national and global sustainable health equity is very precious. So thank you very much. We will now have Adriano Friganovic. He is the president of the European Specialist Nurses Organizations. He's also the president of the World Federation of Critical Care Nurses, and he will speak on their behalf. And he's also executive board member of International Federation of Nurse Anesthetists. He works presently at University Hospital Center in Zagreb, Croatia, and is senior lecturer at Universities of Applied Health Sciences in Zagreb and Jerevan in Croatia. And so the floor is yours, Adriano.
Okay, thank you, Juan. Well, first of all, I want to wish you a warm welcome on behalf of the World Federation of Critical Care Nurses, who is a founder of this movement. To all participants, this presentation is prepared by Professor Jed Williams and me, who are involved on behalf of the World Federation of Critical Care Nurses. And thank you for participation to this important global event. Please, next slide. Well, the WFCCN is an international federation comprised of national critical care nursing societies from exactly 54 countries. It was founded 30 October 2001 in Sydney, Australia, with the key aims to represent critical care nursing at international level and to help improve critical care nursing practice worldwide. Our main goal is to link a critical care nursing association and nurses throughout the world, strengthening the influence and contribution of critical care nurses to healthcare globally, and be a collective voice and advocate for critical care nurses and patients at an international levels. Next, please. And this is our structure. Our main body is a council of representatives. Each country send one representative to our one-year meeting, annual meeting. The board of directors is consisted of 7 members and meeting every 6 weeks. We have ambassadors who represent federation on different occasions and different events. And we have our official journal Connect with main editors and editorial boards. Next, please. And this is how we are working. We are communicating, collaborating, and cooperating with the critical care nurses and other stakeholders globally, so we can build competence, confidence, capacity, and capability in the critical care nursing workforce globally. This global pandemic showed the importance of the nurses, especially of specialist nursing. The most important group was the critical care nurses, and emergency nurses, anesthesia nurses as well. Next one, please. And these are some facts about the nurses. Nurses make 59% of global healthcare workers, and 90% are females. Currently, there is 28 million nurses in the world, but 6 million less than required. Low and middle income countries account for 89% of the global nursing shortage. And in this pandemic, COVID-19 has infected 230,000 nurses and killed 600 nurses. At the moment, I'm addressing you from isolation. This is my 9th day that I find out that I'm a COVID positive. And the critical care nurses were the most affected healthcare workers. Next one. During the coronavirus pandemic, critical care nurses were the most affected group of healthcare professionals. And even we were in the lockdown and couldn't help each other, we find the ways how to help each other and how to move the frontiers to the online space, and did a lot of important projects. We tried to share our knowledge and expertise and experience across the world. We send messages of support to all the critical care nurses through our social media networks. We provided quick resource guide for non-critical staff, translated in multiple languages. We use social networks for sharing information. We create COVID-19 platform at our website to provide accurate and good information for our members and others. We did lectures and discussion forums with the partners and member societies, and we worked with the governments and the health services to support local and national initiatives. Next one. Critical care nurses and World Federation of Critical Care Nurses did some projects about the rights of the critical care nurses, educational standards, recognition and competency framework, cultural sensitivity, and rights of the critical care patients. And these are all components of the global equity standards. And the next one. We also undergone worldwide studies where we explored working conditions, staffing levels, educational programs, formal practice guidelines, and multidisciplinary teamwork. And all these priorities differ between low and middle income countries and well countries. And we what we really want to achieve is equality between all our members and all countries in the world. And the next one, why sustainable health equity? Because we want to have the same educational resources. We want to have safety measures for all nurses in the world. Essential equipment and supplies are highly important. We have to assure quick and confident information services, and that's all the things inside the coronavirus pandemic. But beyond the pandemic, we have to address needs identified by the nursing profession, and we have to have a strong and healthy nursing workforce, which will lead to a strong and healthy society. And next one. And at the end, I want to quote Margaret Mead, that never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. At the end, the last slide, please. Well, this year, 2020, is an international years of the nurse and midwives, and I'm so proud that the nurses showed how important they are in the all healthcare sectors and the systems. Well, thank you all.
Thank you so much, Adriano. We all wish that you keep well. Your role is so important. You've reminded us that nurses are 60% of the health workforce in the world. They are the forefront of healthcare. Critical care nurses have been and are being at the central response of the pandemic. They are also the most affected. And your organization supports the training, capacities, safety, and other conditions for such essential role in these challenging times. Your testimony, commitment, and knowledge is essential to everything we do. And we thank you so much for your contribution to the movement, for your daily commitment and efforts, and for your time during this event. May I now introduce Sir Michael Marmot. He is a professor of epidemiology and public health and director of the Institute of Health Equity at University College London. He chaired the World Health Organization Commission on Social Determinants of Health, and also the commissions on social determinants of health in the regions of Europe, the Americas, and the Eastern Mediterranean region. And he's also former president of the World Medical Association, and on their behalf, he will be addressing the meeting. So yours is the floor, Michael.
Thank you, Juan, and thank you, colleagues. Doctors, along with other health professionals, have been on the front lines, selflessly giving of sometimes their lives to combat this pandemic, which is why they're strong supporters of WHO's priority for universal health coverage, UHC. But the World Medical Association and doctors recognize the importance of the social determinants of health, what happens outside the healthcare system. And as we've seen, the social inequalities in COVID-19 mortality follow a social gradient. The more deprived people are, the higher the mortality from COVID-19, which looks very similar to what we see for all-cause mortality. In other words, the social determinants of inequalities in COVID-19 mortality are very similar to the social determinants of health more generally. And that means we have an evidence base that tells us what to do. We need to address the conditions in which people are born, grow, live, work, and age, and inequities in power, money, and resources that give rise to the inequities in the conditions of daily life. And then, as Dr. Tedros and Dr. Bachelet have said, the societal response to COVID-19 lockdown has amplified those inequalities. They've made things worse for people lower down the social hierarchy, those who are poorer,
and have not much affected those who are richer. In fact, data from some countries show that the effect of lockdown has been to exaggerate wealth inequalities. The rich have got richer and the poor have got poorer. And that insight and understanding tells us what we have to do to build back better. The twin challenges facing our world are the climate crisis and the crisis of extreme inequalities. And we need to put these agendas together as we think about reconstructing societies. We do not want to go back to the status quo ante. The state of the world before the pandemic was not ideal. There was much that needed to be done. And we need to see this threat of the pandemic as an opportunity to build back better, addressing the climate crisis, addressing the extreme inequalities, and doing it in a spirit of cooperation, of solidarity, exactly as Dr. Bachelet has said. And that's why the WMA is strongly supportive of this Sustainable Health Equity Initiative. Thank you, Juan.
Thank you so much, Michael. I think all of us who look at health beyond our white coats, those of us health workers that look into the root causes of ill health, admire your work for so many years, your leading role in reminding us that the main diagnosis of most diseases lies with ill conditions of life, as you have said, conditions in which people are born, live, work, and age, and how COVID-19 is replicating the same evidence that you showed over the last 20 years of how social determinants of health condition that which is the most cherished and important universal right. And you've also reminded us and expressed very clearly the main twin challenges that we all now face. We, and more so even our children and our grandchildren, whose future is our responsibility, everything we do. Extreme inequalities, which are widening with the pandemic, and climate change, and how we should come out of this pandemic in a different world, a world based on solidarity and collaboration. Thank you so much, Michael, for your words, for your essential contribution to the movement and to everything we are doing to promote health equity worldwide. So now we will have with us Dr. Rocío Sáenz. She is a medical doctor, professor of public health at the University of Costa Rica, president of the Latin American Alliance of Global Health and of the Equity Network in the Americas. She is former Minister of Health of Costa Rica and president of the Caja Costarricense del Seguro Social, Costa Rica Social Security Fund. So yours is the floor, Rocío.
Thank you and good morning. I am very pleased to be here with you and all the attendants. I feel and I know that this is an important meeting and we are expecting that this movement could be stronger day by day. The next slide, please. The Latin American Alliance for Global Health is constituted by a very prestigious universities and academics from Latin America. We have the people from the National Institutes of Public Health of Mexico, Universidad de Costa Rica, Colombia, Peru, Chile, the Fiocruz, and also the School of Public Health in Sao Paulo, Argentina, and Nicaragua. Our alliance is, we try to facilitate the cooperation and the linkage of the diverse academic institutions and develop the education and training project research, and social projects to address the global health problems in the region. The next please. ALASACs arise in our region with the vision that the global health require an approach on human rights, equity, and social justice. Of course, in these interdependencies of current reality. The purpose of our alliance is to strengthen the knowledge about global health in the region, but also to be part of the international, national, and local academic and political debate. Next, please. The Economic Commission of Latin America has shown an evidence, of course, of the recession that the COVID-19 is the consequences for our region. And it's important to share with you the importance of the increasing of the unemployment, the effects of the poverty, and also the close over the 2 million companies and fall in private investment, but also the extraordinary burden in fragmented health system and the weak performance, especially in the primary health, but also in ICU services. And this is two parts of the response that our community and the population needs go in the best way. But we have in the region this weak performance. The next, please. As ALASAC, we think, but we believe, and also we have the data right now, that the COVID exposed the pre-existing inequalities, which has caused feeling of anger and frustration on all levels. The pain, suffering spread throughout the region, affecting mostly the population with the highest social disadvantage. The sanitary, economic, social, and environmental response must go together. That is the lesson learned we have right now so far. But also it's important to share with you that we know right now the all life and the environmental has to be at the center of the decision maker. This is no, they take one another. We have to take these two issues as a society and a common point to take decision. Thank you. The next, please. ALASAC can bring to the global movement knowledge and presence of the most unequal region of the planet. Experience in research and action from the community to the global level, in health system, primary health, migration, and indigenous people, and among others issues important. Of course, mapping and contact with key actors, institutions, and processes. And of course, the commitments with the collaborative work. From my experience as a woman, as a medical doctor from Costa Rica, a country with a huge investment in education, a strong health system based in primary health, without army, at the country that they ask at the call for action for share the knowledge and share the innovation with the COVID, that we can do all together, we can make the difference. And this is really the challenge that we have right now. Can we do that? If we can do it, we can move forward and give for the new generation hope for a better world. Thank you.
Thank you very much, Rocío. And thanks so much, may I say, for your lifelong commitment to the right to health, from communities to government posts to regional leadership like the one you have taken us from the global challenges to a regional reality. A region, Latin America, that suffers the greatest levels of inequity. You gather the efforts in the region to stimulate education, knowledge, networking, and commitment to face global health problems in the region. And as you said, the region is badly hit by the pandemic. And this once again reveals how the pandemic is not doing anything else than highlighting the existing inequities and augmenting them. You've mentioned the very dramatic economic impact and how the impact is worse in those most vulnerable, informal workers, and so many others, over half of the population in the region, and how we should not forget, as Michael said earlier, the essential factor of the environment, and how Costa Rica is an example of advancing towards universal healthcare for many years. It's one of the leading examples. It has no army, and it respects planetary boundaries like very few other countries in the world. And to no surprise, is one of the countries less affected by the pandemic because of those social justice conditions, despite the many challenges also faced by the country. And being brought to that regional and country reality, I have the honor of introducing now Dr. Bernice Dan. She is Vice President and Executive Dean for Health Sciences at the University of Liberia. She served as the Minister of Health for the Republic of Liberia from 2015 to 2018, years during which the country was facing the challenge, among others, of the Ebola epidemic. So yours is the floor, Bernice.
Thank you, and good morning, good afternoon, and good evening to my colleagues on the panel and to all our listeners. As we all know, there's a baseline equity issue in differences between the strength of the healthcare delivery systems within low and middle income countries and that of high income countries. There's also the equity divide within countries, whether low, middle, or high income. During the Ebola outbreak, during the Ebola outbreak in 2014, the global approach was very specific to a threat to global health security. The support to our 3 countries that were highly affected came as a result of the threat that the disease posed to wealthy countries. The support was not prompt, but it came. This is not happening now with the outbreak of COVID-19. Low-income countries are left with less international support as every country focuses on its own needs. Have we forgotten the lessons from Ebola so quick? In line of pandemic diseases, pandemics create pressure and creates a tension. It happened with Ebola. Ebola response was a multi-country and a whole government approach in our 3 countries that were highly affected. COVID-19 has created similar attention, but have made equity more divisible. During the Ebola outbreak, we were able to contain Ebola because of the support we got. And what we heard mostly at the time was the 3 countries had weak healthcare delivery system. With COVID, there's a global threat, and we see healthcare systems that the globe have considered, all of us have considered strong healthcare delivery systems crumbling. It has impacted the lives of individuals, economies, and the rest. Therefore, there's a need for a global leadership and a global response to pandemics. Otherwise, countries with weak healthcare delivery systems will continue to pose a threat to the global health security. Today, you cannot say if you get rid of COVID in the wealthy countries, you are safe if it is still in low and middle income countries. The World Health Organization that has the mandate to ensure we have global health security was blamed globally for the delayed response during the Ebola epidemic. Today, the World Health Organization, I would say, has responded fairly early to COVID-19. Yet we see some countries and some individuals blaming them for the response. But what is worse is that some countries are withholding funding to the World Health Organization, the organization that has the global mandate to ensure that we have global health security. For us, in low-income country, a country like Liberia, that is of concern to us because that will actually help to further the equity gap. An epidemic paralyzes weak systems further. If you remember Liberia's story, Liberia was recovering steadily, economic-wise, health systems building-wise, from 14 years of war. Then we were hit by Ebola, and that carried us backwards. We have started rebuilding again, and now we have COVID. The impact of outbreaks tend to have impact on other preventable conditions or treatable conditions. And so that can lead to more deaths and more morbidity than even the outbreak itself. We saw that during the Ebola outbreak. Now, because our countries are poor and we have an epidemic, and at the moment, we also do not have the kind of support we need to have, there's diversion of financial and human resources to fight the pandemic at the expense of routine healthcare services. That's a coping mechanism. So by default, governments are responding with their meager funds so that they will respond to the epidemic. Who knows whether they will be able to respond adequately? And that is at the expense of almost all the basic healthcare, basic services, not only healthcare, but basic services. We also saw during the before the Ebola, Liberia was steadily moving upwards in terms of its economy. And then we saw a steep decline, like you see with COVID in the world today. For our part of the world, financial stimulus is not a possibility. Small businesses will shut down, and governments will not have the money to restore them. The effect of Ebola made us and forced us to re-engineer our healthcare delivery system. Can we re-engineer the response, the way we respond to pandemics? It is not possible for Liberia to compete with wealthy countries to stockpile supplies and drugs. It is obvious. So even with our meager resources, if we want to have supplies, we might not be able to get it. So we need to respond to pandemics globally. We need global leadership and global response. And equity should be the trust of that global response and global leadership for us to ensure sustainable equity in health and to ensure global health security. Thank you. Hello, I'm done.
Thank you, Dr. Dan, for your words. We really appreciate, the voice of your experience and your call, for international solidarity in the response to the pandemic. I think that your statement just gives all of the attendants in this movement the perspective on what it means to go through an epidemic as ravaging as Ebola, and how now you're starting to be affected by COVID-2. Thank you for your words and all your work in Liberia, and we will continue working together to further discuss.
Thank you, David. And sorry, the noise, the sound went off for a minute, but I could hear the presentation, and I echo what you just said. And we are so honored, Bernice, for having your strong African representation in this meeting today in the movement. Africa has been neglected for centuries in so many ways, and our environmental damage is also most noticed in Africa. And as you said, in these challenging times, if cooperation goes down, it just shows that we have to change, that we cannot continue having a world without solidarity, and that health service delivery, as you said, is essential to face this pandemic and the other challenges around inequity to come. May I now introduce Sara Ferreira. She is a second-year medical student from the University of Massachusetts Medical School. She has researched into the effects of COVID-19 pandemic in the United States. And we will finish with Sara, and we wanted to have this last voice, but not the least, because it's the youth that needs to be at the forefront of what almost every one of the panelists has reminded us, that we need to change. We cannot continue business as usual. It's the business as usual of our and earlier generations. Despite our efforts, the system has created inequities. It has bred pandemics like this one, others to come probably, and we need to change. So with Rocío, Bernice, and Sara, we finish with three strong women showing the leadership in different generations and regions of the world in facing this pandemic. So Sara, yours is the floor.
Thank you, Steering Committee, distinguished speakers and guests. It is an honor to participate in the global launch of the Sustainable Health Equity Movement. As a rising second-year medical student at UMass Medical School, I, along with other students, was given the opportunity to work with the Steering Committee to study the impact of COVID-19 on the different populations throughout the US. We already knew about existing health disparities and systemic racism in this country. But as we looked into the data, the far-reaching impact of the pandemic into all aspects of inequities is all the more sobering. For example, there have been over 20,000 deaths among African Americans, which equals to a rate of 1 per 2,000 of the US Black population. Also, young Native peoples, African Americans, and Latinx are 5 to 7 times more likely to die from COVID-19 compared to young white people. Finally, in New Jersey prison systems, the infection rate is 13.5%. While COVID-19 did not cause these inequities, the pandemic and its economic consequences have exacerbated systemic issues. It has been disconcerting to watch how a wealthy and well-resourced country has been unable to come together with a clear vision and set up a coordinated and organized response to the pandemic, We have seen the fragmentation and politicization of this public health emergency cause harm to the most vulnerable members of our society. There's no planning for PPE supply chain, testing supplies, or medications. Costs skyrocketed and systems broke down. Though various actions have been taken, there has not been a cohesive response in the time that needs it the most. How will we manage when we have a vaccine, or as infections grow to their highest daily rate yet, and the situation is even more dire? In the light of this substandard response, we see an opportunity to do better. We as a country in the world can work together and coordinate within and among nations. Collectively, the world has the resources to meet the demands of all nations in this pandemic. This is really the challenge. We must set our standards high and not settle for a haphazard response. So let's aim to create systems that work for all, especially those who are most risk of death from COVID-19. This is where the UN and the WHO can be exemplary, by leading with a moral compass to help guide our unified response to address the systemic issues of racism and inequity in novel ways, and make long-lasting changes in our health and economic systems. We must address the worldwide supply chain issues and resources needed during the COVID-19 pandemic, but also build a stronger foundation so that sooner rather than later, all people of the world, no matter where they live or the color of their skin, can reach their full potential and live a dignified life based in sustainable equity and justice. All we hope is that the monumental task ahead of us can serve as a catalyst for the broad and systemic change needed to address this crisis, and any others that have existed for generations related to human health and well-being on a global scale. We, in partnership with future generations, are making a lifelong commitment to the work of enacting these changes and ensuring their sustainability. This is our moment. We are relying on our world leaders like you to join with us and help move mountains. Thank you, and let's get to work.
Thank you so much, Sarah. Representing the youth and the health workers of the future, but more than that, the new generation taking the lead and telling us that things need to change, and equity is a basic principle. It's very clear in the United States, and it's also clear in the rest of the world. So we stand together, and we count on you. Now, may I say as some final words from our movement before I give the word back to the Chancellor of the University of Massachusetts, who kindly hosted this meeting, that you have heard, it's close to 1,000 participants, you have heard the spirit of this movement. We have so far in these 3 months gathered many people who are concerned, they are committed, and they are resolved to change the root causes of this pandemic, the inequity it breeds on, and the inequity it further undermines. So far we have been establishing the formal relations with the World Health Organization, with the United Nations Secretary Council, Secretary General, and more recently with the UN High Commission on Human Rights. It is now the time, the launch of this movement, this event, to make it a participatory movement. We are impressed, I would say we're overwhelmed by the wealth of the movement. It goes across regions, across specialties. It goes beyond health sciences and practice. It gathers advocates for the right to health, advocates for social justice, advocates for environmental sustainability. So we now have the opportunity to work together, to bring it to scale, to be a very strong actor in the wide scene, and to do our best from all the capacities you have heard today, from the scientists, the public health specialists, the health workers at the front line, the regional organizations, national leaders, and also the youth. And many more among you represent so many other dimensions of ecology, economy, and everything that affects human life. So please, from this moment onwards, the interim steering committee that has taken this preparation of the birth of this movement I think this is almost like a naming ceremony, like a birthing ceremony of the movement. We will call on your participation. We will structure the movement now with thematic areas across all regions and countries. And so we really count on your support, your ideas, your courage, and your willingness to change in the basis of solidarity and collaboration, words I have heard most throughout the event. I would, with these words, excuse ourselves for not having the time to have a debate on questions and answers. We will call for another event soon on essential areas of sustainable health equity, and we hope to be more and more participatory and join hands for this in this challenge. So please, may I give the word back to the councillor who has so kindly hosted this meeting and enabled it to happen. Yours is the floor.
You have the floor, Chancellor.
Yes, thank you very much, professors. Thank you very much for all of your participation today. We are working on a truly historic initiative, and I want to thank all of you for your very thoughtful words, for the inspiration that you provide to folks across the world. Truly, together, we can make an enormous difference in the lives of so many. And I thank all of you for your participation today. We look forward to partnering with you long into the future. To each of the organizers, to each of the participants, to each of the speakers, most importantly, to each person around the world whose life we can impact, I thank you today.
Thank you.
Thank you very much.
Thank you, everybody.
Thank you, everybody. We will now leave the video again. We exit the meeting. Thanks for your time, and we will see you all soon. Bye for now.
Bye.
Thank you.
Thank you.